Hi, my name is Gabby. I'm going to be the student massage therapist for today. And today I'm going to be doing another palpation video. For this palpation, I decided to palpate the extensor carpi radialis brevis. And again, the benefits, it will help me determine the resting state of a muscle. And if there's any abnormalities, the palpation assessment will tell me that. And then some of the risks that I can reproduce pain or discomfort if there is any abnormalities. So with the brevis, your origin is the lateral epicondyle here, so that's going to be one of my landmarks. Lateral epicondyle, and then the insertion, it travels distally to the base of the third metatarsal, so right about there, right where the base is. So the actions, what it does, it extends the wrist, and it also performs radial deviation. And then again, the fibers run horizontally, so up and down. So it's important to know that there is a longest portion of the extensor carpi radialis muscles. There's a longest and a brevis portion. The longest inserts up at the supraepicondylar ridge, just like the brachioradialis does. So I'm just going to mark that kind of to avoid that area. That's where the longest goes. I'm going to mark that in purple, just for demonstration purposes. Again, base of the third metatarsal, if I can palpate that, that's where extensor carpi radialis brevis will go, and then lateral epicondyle is where its origin is. So these are my two landmarks. So I'm going to palpate in between these two X's here, the blue ones. That's where brevis is found. When you want to palpate, you want to have it closer to the person's body. So you want the elbow bent, and then bring it closer to the body so that longest doesn't get activated here. I don't know if you can see if I do that, but I'm just going to have it out here just for demonstration purposes. I don't know if the camera will catch it. So again, if you want to activate it, you can have them extend against weight and then radially deviate. But again, kind of like the flexor carpi ulnaris, it's a very prominent muscle even without weight. So when I palpate this muscle, I just ask the person just to simply extend and radially deviate. It'll just pop up right into my finger. And then once you go distally down, you want to really cross fiber palpate just because it gets tendinous here and it's a little bit harder to palpate. So again, up here where the meaty portions are, I'm not too worried about cross fiber palpating. Of course, you still want to, just to get the, the 4 T's of palpation. But once you get down here, you really have to dig in there. Okay, so let's begin. Again, starting with my lateral epicondyle, having myself extend and then radially deviate. My finger automatically pops up there. And again, just 2 fingers, and then do a cross fiber palpation. And if you always, if you lose yourself, you can just have them do it a couple times until you see that it pops up there, and then continue your palpation. There. No temperature. It is a little ropey, a little bit of hypertonicity, and there is some tenderness there. So I do have tight extensors though, so okay. And then here you really want to cross fiber palpate here to really feel that muscle activate. And you want to cross the wrist joint here to the insertion to the base of the third metatarsal. And that would be your palpation of extensor carpi radialis brevis.